Welcome and good afternoon, should I say. We're just going to do some Fika and Poppy formalities. So John's just going to run through just a quick intro into our Poppy Act and the recordings.
Hi everyone, it's a small group, but needless to say, we have to just inform all participants that in terms of the Poppy Act, if there's any reason why you do not want your name to be present on the screen for the purposes of subsequently uploading onto our YouTube channel, you need to advise us accordingly, or alternatively, I need to ask you to leave the room. So that's my little 2 cents worth. Good afternoon, everybody, and welcome. Michelle, so lovely to see you on another Wednesday, and so nice to see our usual faces. It's a pleasure to have you here, and a very interesting topic this afternoon, mental health. And from my perspective, mental health and cancer has hit me quite hard quite recently, so I'm very interested to hear what you have to say, and hopefully some little tips that we can keep in the back of our minds to use on a day-to-day basis. Besides, and we've had discussions, Michelle, about positive affirmations and saying I am well and I'm healthy and I am happy. I do think and I do believe that it does extend beyond that. So if introduction from you, and let's get this ball rolling.
Thank you, everybody. And quick intros for those that will be perhaps watching or listening for the first time. I'm EVY MICHALOPOULOS. I'm the founder and the CEO of the Mahifilo Cancer Project. John is co-founder and director of the project as well. Thank you, John, for that intro and legal formalities. He heads up the legal part of the project as well. And as he mentioned, mental health for cancer patients, that's our topic today, and that's what we're going to be chatting about. And we are so proud and privileged once again to have our guest speaker, Michelle Göldner, join us. Michelle is an NLP Life MindBody Cancer Coach, and she's assisted the project as partner. And Michelle, I'm not going to carry on too much about your amazing background. I think I'm going to hand that over to you as a little intro. But thank you so much for joining us today and doing this presentation with us. So over to you, Michelle.
Thank you, guys. Hello, everyone, and thank you for joining us today. Yes, I'm not really very big on intros, but a little bit of background, as I've done psychology, child kinetics, very into mind body and how the mind body relates to our mental health, our stability, our psychological well-being, and how we bring it all together. And also cancer has been a very big part of my life, all my life, as far back as I can remember. So it was kind of a natural progression to go there and work with cancer patients, doctors, oncologists, partnering with you amazing guys, creating awareness and some knowledge for everyone out there, because knowledge and education saves lives. The sooner you can detect these things, the better the outcome will be.
That's very true. Very true. Thank you for that.
Okay, so I think we're going to get started. We've got quite a bit to discuss. I'll try and keep it short. Mental health is very broad. It's very expansive. It's not a one-size-fits-all, and everyone's extremely different. There's a lot of things going on. Mental health, a lot of people confuse it with mental illness. There's a big difference. Mental health basically just refers to your mental hygiene, as we call it. When we get anxious, when we get depressed, sad, when we worry a lot, we have anger issues related to certain events that happen in our life. That's kind of related to mental health. And these aren't psychological problems as such. They're just things that we experience because of situations and events that we've been through. So I'm going to share my screen with you guys, and we can look at the... Okay. We can look at my PDF. Can you guys see it?
Yeah, there we go. It looks perfect.
Okay, fantastic. So that is our mental health. And we're just going to carry on here. So what is mental health? Mental health is basically what they declare as a state of well-being in which an individual can cope with day-to-day stresses and day-to-day life, whether they can be productive and whether they can actually fruitfully contribute to the community. So they estimate that 1 in 3 people that's been diagnosed with cancer has some form of mental health. So that could be depression, anxiety, stress, worry. And a new study has found that mental health problems often arise at the very end of cancer treatment, not so much during, because people are in survival mode and they're dealing with the day-to-day stuff. So when patients expect to recover after treatment, they're usually hit with this uncomfortable, like, snowball of emotional issues that they weren't really expecting. So psychological concerns of cancer patients, that would kind of be the awareness of mental health for cancer patients, and around the recent studies that they've done on survivorship care. So we still lack a lot in survivorship care programs. It's been around for a while, but it's not as prevalent, and it's coming to the fore a little bit more, and it's being discussed between therapists, the cancer patient, and their oncology team. And such programs are being recognized now as a distinct phase of the cancer trajectory, which we feel is very, very important. During treatment, as we said before, cancer patients go day to day, survival, survival, survival. I have to do, appointment. And then they get to the end and it's like, okay, now what? What do I do? So survivor cancer care programs provide many opportunities to provide the mental health, the wellness, and also quality of life planning for people who stop treatment. If at any time anyone has any questions or anyone wants to know anything, please feel free to interrupt and we can just take it from there.
Thank you.
Cancer survivors report ongoing struggles. So they struggle to achieve balance in their lives. They're trying to make sense, feeling whole, finding a life purpose again, because cancer is basically a very life-altering experience. Individuals most often want to reassess their life after treatment. They want to search for a different type of meaning, find a sense of control. Survivors also that's free of cancer may be immobilized by fear of cancer recurrence, and they have difficulties in making life decisions like, do I go back to work? Do I want the same career? Day-to-day planning, they struggle to do that. Marriage, if they haven't had children before, what is the way forward? So they kind of experience an existential and spiritual crisis as such, and that arises and that relates to the concerns about death, dying, and most likely the majority of cancer patients I've worked with have a completely new orientation to time and future. So their values are changed and their goals as well. Cancer normally affects not just the individual, but the entire team. And it has an impact on the entire family, the needs of the children, the spouses, the loved ones, all the people that's been involved in taking care of this specific person with cancer. So we find caregivers and family members often require, but they don't receive the respite, the healthcare, the psychological care, or even financial assistance that they need in taking care of someone who has cancer. So to better provide long-term assistance to cancer survivors, we as therapists feel that before we can implement or plan a cancer survivorship program with someone that determines their mental health, their stability, and giving them the necessary tools and techniques, there should be a standardized self-administration questionnaire that is used after treatment in the oncology department with their doctors and navigators to assess symptoms and functioning in either physical, psychological, social, and spiritual domains. So cancer-specific concerns is fear of recurrence, generalized symptoms of worry, fear of the future, of death. They're having trouble sleeping, ongoing fatigue, and then obviously also they struggle to still concentrate. So there's just like a short recap of what mental health is. It's not an illness. It's just struggling to deal with day-to-day stuff. Just keeping your mind healthy. There's also the concerns that most cancer survivors has, as we've mentioned. So a very big thing for cancer survivor is definitely fear of recurrence. And we would probably say that that's the number one side effect of all patients. The American Cancer Society has actually done a study, and they found that 70% of all cancer patients worry about recurrence. They said it's about 1 year after treatment. I would beg to differ and say it's almost kind of as they slow down the treatment and they come to the end, that they start having these fears. Okay, what's next? How am I going to make sure that this doesn't come back? So they also have fear of medical symptoms. Any ache and pain can ring an alarm bell. So triggers is little reminders, the smell of the hospital, the machines that you hear in the hospital, those can all be triggers that activate fear and anxiety responses within cancer patients. That's just a quality of life model that I usually use in putting together a survivor care plan for someone. And this is usually done with the oncology team, the navigators, and the doctors. So we see what the diagnosis was, what the treatments were, when the follow-up should be, and then we work out where this person is at once they've stopped treatment, and we go forward planning on psychological well-being, social well-being, family and work integration. So as we've mentioned, recurrence. So we usually say that people should reach out and talk to a therapist that will help them work through triggers and fears. You must know that you're not alone in these concerns, and then also to have the tools and learn how to control and manage relating symptoms. Gaining perspective for cancer patients is great for improving their mental health, and then also to control over everyday situations. For us, day-to-day control seems quite obvious, but when you've been through something for such a prolonged period of time, the normal day-to-day decisions become quite hard. We're also going to discuss some other mental health issues or problems, as they call it, which is depression. Depression, major depression, and depressive symptoms occur frequently in cancer patients. They're not as prevalent during cancer treatment, more so afterwards, because that's also when the patients start asking, okay, what is next? Where am I going? What is going to happen? I feel a little lost. So the prevalence rate vary from about 10 to 25% for major depressive disorders. And that rate is 4 times higher than the general population major depressive disorders. And I think that's quite high. The term psychosocial distress is affecting a general mental health, and that includes depression, sadness, severe worry and anxiety, uncertainty, and always a heightened sense of vulnerability. So the flip side of good mental health or bad mental health is good mental health, and that would be feelings of gratitude, good fortune, a sense of self-esteem, and definitely a sense of self-mastery, so you can feel that you have control over day-to-day functioning. Distress is a very multifactorial term, and it encompasses unpleasant emotional experiences of psychological nature. These are cognitive, behavioral, emotional, social, and even spiritual, and they may interfere with a patient's ability to cope effectively with cancer. The physical symptoms as well, and the treatment of interactions they have with people on a day-to-day basis. Depression may be experienced as a reaction to the disease and its treatment, but it's also a result of the consequences of the disease on employment, health insurance, social functioning, and also very much so family relationships that take a huge knock during this ordeal. Many cancer survivors function in survival mode, like I've mentioned before. So when they're in the midst of things where they're going through day to day, they're just trying to get through one day at a time. They hardly ever report feelings of depression, anger, or anxiety. And that makes it quite hard, because when you get to the end of the road, those symptoms are kind of magnified by end of treatment. And then they feel extremely lost, and major depression can set in. A lot of cancer patients also feel very alienated and extremely lonely. And some are isolated when they're in treatment, because then the doctor visit stops. There's less support from friends, because everyone's kind of expecting you to kind of just, it's over now, you have to get back to normal. So there's not really a new normal as such that can be defined unless you have someone that walks the road with you and explains to you, what is going to happen next, where to from here. Let's put a cancer care program in place so you know what to expect and you can regain some form of control. Cancer survivors face a variety of emotional challenges, like I said, stress, anxiety, depression, and they can range from workaholism, where people overdo everything, OCD, where they have anxiety, fear a particular thing or place, and some people even isolate themselves so much that they refuse to go anywhere. So these things have a huge impact on people's relationships and their life. It's very hard to distinguish which is depression and which is anxiety, but in the end, it all gets in the way of getting on with your life. So the bottom line is basically finishing your cancer treatment doesn't mean that the emotional toll of this journey is over yet. It's kind of only beginning. It's not unusual for people to experience some sort of stress and anxiety, and it's hard when you worry about your symptoms because it amplifies every little detail. So we would normally suggest if you have any of the following symptoms for more than 2 weeks and they persist, you feel that they're not going away, you should probably either speak to your doctor or enlist the help of a therapist to walk this path with you. So those would include feelings of being extremely worried, anxious, sad, depressed, that emotional numbness. We also call it dissociative disorder, where people completely dissociate from themselves and others. The feelings of overwhelm, lack of control, feeling shaky, uneasy, sense of guilt and worthlessness, feeling helpless, feeling hopeless, displaying irritability and moodiness, having difficulty concentrating, feeling scattered brain, crying a lot, focusing or worrying about problems that's not even yours, become unable to enjoy things like food, intimacy, socialization, when you try and avoid situations or even all situations because you have thoughts of not being in control. A very big one that most people know by now is when you have suicidal thoughts. That's definitely a red flag. There are also body changes that suggest anxiety and depression, and bodily changes we've mentioned before can be weight gain, weight loss, insomnia, increased need for sleep, racing heart, dry mouth, increased perspiration, upset stomach, diarrhea, headaches, aches and pains. So as much as you may be affected by cancer, it doesn't really alter your basic makeup. There's a nice saying that says a life with cancer is just like a life without cancer, except that everything is magnified. Everyone still there?
Yep. Yeah, we are.
Okay, great. So there are many ways that we can cope with a life after cancer. It helps to understand how to develop coping techniques and introduce positive thinking to your arsenal. They have inquired on more and more studies and research papers that positive thinking, or positive psychology as it's known, is very beneficial for people after cancer and for all mental health disorders or problems. So other health benefits credited to positive thinking or positive psychology is increased lifespan, low rates of depression, low levels of distress, a resistance to your common cold, better psychological and physical well-being.
Sorry, Michelle, we just had an audio issue with one of the participants. Don't stress. We've muted them.
Oh, okay. Not a problem. So better psychological and physical well-being, reduced risk of death from cardiovascular disease, and better coping skills in hardships and times of stress. So to talk a little bit more about sexuality and intimacy. After cancer, people want to feel whole and they want to feel that they are adored and that they are good enough. And part of this has to do with their sexuality. So after cancer, you want to be held, told you're beautiful, feel desirable. And most times when survivors try to engage with their partners, the partners are too scared that they may hurt the survivor, and they want to allow them time to heal and gain some sense of normal. Yet to a survivor, this can feel completely like rejection, and it can create feelings of anger and also feelings of being unloved. On the flip side, getting intimate can leave both parties feeling miserable. The partner might not know where to touch you, wonder whether they're hurting you, and then maybe unknowingly bring attention to a scar. And this can make the survivor feel self-conscious and frustrated. And the buildup is usually not at all what they envision. So feeling tired and awkward, and maybe even that their bodies are not working with them, can all contribute to further stresses in the relationship after this, and also to your mental health. So as you can see, we're touching on a broad spectrum of things, not only for cancer survivors and the areas of things that they face, but also how big and encompassed mental health really is, and on how many aspects of our lives it actually touch. The National Cancer Institute reports that more than 40% of cancer survivors experience some sort of sexual dysfunction. So it's almost always the treatment and not the cancer itself that causes the problem. Sexual intimacy affects the quality of life and continues longer and is uneasy and difficult to discuss. I mean, it's very hard for us to discuss our day-to-day life issues with a stranger, let alone your intimacy issues. So there's this hesitancy to bring up sexual problems. Intimacy problems are mind-body issues, and they demand attention because it's related to psychological, relational, and cultural levels. And they may require medical treatment, information, and definitely some form of emotional support. And we all know if you have another set of eardrums focused on your concerns, you can normally sort them out a lot better. Two brains are better than one.
Yeah.
So the first step in this scenario is to talk with a professional and to try and dissect various issues involved. It might not be a sexual dysfunction. It might just be a mental issue, an anxiety issue. You might be depressed or you might be angry. And if we work through those types of things, it's better to get to the root of cause of the problem. Be they difficulties with arousal, performance, you can tackle each component one at a time. So therapy is also a medium for you and your partner to feel heard and understood, and it can definitely create a very strong union. Fertility is a whole other can of worms, yet the underlying emotional experiences follow on sexuality and intimacy, and it can basically be discussed with the topic of sexuality and intimacy. Another thing we find is quite big for people after cancer is returning to work. So cancer is a wake-up call. It nudges people to rethink their career choices and also the work-life balance. It can bring forth feelings of, okay, who am I now? Now that all of this is over, what is my purpose? Are these things even important to me now? Survivors relate every area and aspects of their lives after cancer, as you're not really exactly the same person coming out that you were going into this whole ordeal. You kind of have a deeper understanding that life is really short, and you have a need not to waste that time on things that you did before, because it also won't really make you that happy. So at the same time, having been in survival mode for so long, you've also now kind of lost your identity, your sense of purpose, the meaning you had, and you're not really sure whether you will beat this disease. And even if you do beat the disease, will you live? You have all these questions going through your mind, and this can cause a great deal of anxiety. A lot of people going back to work also afraid, am I able to do everything I've done before? So they've done another study, and it reports that as a rule, cancer survivors don't work as much after cancer as they did before. They're likely to work 2 to 4 fewer hours a week, even as much as 2 to 6 years after a diagnosis. And that can really be mentally challenging for them. Most survivors want to return to normal as soon as possible, feel productive, and like they're able to contribute again, which is why they want to return to work. And this also adds to their sense of self-worth and sense of self, which is your identity. The two biggest challenges I've seen so far when it comes to returning to work following a cancer treatment is handling the work itself, or the load of work you have to do, and managing or re-establishing all your relationship with your colleagues, your friends, and your bosses. So preparing yourself mentally and physically before going back to work is very important, is you're not always capable of doing all you did before. You might have to make some physical adjustments, mental adjustments, also emotional adjustments before you decide to enter the workforce again. So as I've said, some physical after effects or even mental ones like memory, you need to be able to manage and discuss a game plan with either therapist or your boss. It's usually a very good idea. You might have to make some changes to your work environment, like files that you used to be able to climb up on a ladder and get down will now have to be moved down for you. And you have to also remember that you've got nothing to prove, and that working on a work-life balance is not always as straightforward as you would like to think. Having a game plan for when things don't go your way, that's the way we're going to put you back in the driver's seat. We're going to reduce your anxiety and your overwhelm, and we're definitely going to give you back some form of control when you need it the most. A lot of people are also struggling with, what are other people going to think? It's true when they say you find out who your true friends are and who you can count on in tough times. We've all learned that people's behavior and reactions are not things that you can anticipate, yet you will need that mental resilience to know whatever those reactions are, it's not really about you. This is where I usually tell my clients, this is the one time in your life you have to be selfish. You come first. You have to come first, you're number one. You have to put all your physical, emotional, and mental energy into fighting this disease and beating it. And if people don't understand that, well, you can't be sitting there holding their hands, babysitting them to make them feel better while you're feeling bad. You're the one going through cancer, it's not them. On the flip side, in most cases, most survivors have their friends, colleagues, and family rally around them, showing up in ways they couldn't even imagine. So these are the keepers. The rest wasn't supposed to be on your journey. And I know it's easier said than done, but when we're mentally resilient, these things are easily to accept and take forthwith. So the same scenario when you're done, the same people that rallied around you now leaves to carry on with their lives and their jobs. And it's almost like you feel you're disposable and no longer a priority. These can bring up feelings of anger, rejection, anxiety, low self-esteem, and confusion. And we never really know what to expect. So having tools to learn how to be resilient, deal with uncertainty in times of fearful situations, they're bound to assist in lessening symptoms of depression, anxiety, and they will definitely assist with stronger self-esteem. You will need to have a strong sense of self, as even when the cancer journey is over, people will still associate you with cancer. So I think talking about all these things kind of brings forth how mentally resilient you have to be, and how these small little nuances come together, build this big snowball of after effects. So if this is how cancer patients are feeling, a lot of people feel like this day to day. So as we said, everything is magnified when you've had cancer. It can also be very frustrating. A lot of people experience a lot of frustration because it adds to that sense of loss of identity. Who am I without cancer? Or am I just this person now? You have to think about all these things, and it can add a lot of strain on your mental abilities and mental stability. So you have to think about what your needs are and what you want from your relationships and also in your life, and the type of people that's now important to you. It's often easier to hear thoughtless statements and questions from someone who is unimportant to you than it is to hear them from someone whose opinion really matters to you. So we teach our survivors a lot of valuable CBT techniques during and after the journey that can massively assist in helping them alter their thought processes and their behaviors that lead to more neutral outcomes. So CBT teaches us that we can have control over how we react to what others say and others do. It helps you basically dissect your thought process, where it's coming from, why it's there, is it factual, does it serve you, is there any meaning to it, does it have any relevance? Because we sometimes add relevance to things that's not really relevant. The best thing we do when people, the best thing we do when people make well-meaning yet hurtful comments is to call up someone to talk to and let it all out. Try not to take it out on your well-meaning friends and family. Talk to someone else about it and just have that time and that space to vent. Like we said, it's always good to have it, yeah. People kind of expect you just to get on with life like nothing's happened. And for you, nothing is the same. So this can, again, cause a lot of loneliness and feeling misunderstood. So that kind of brings us to what a lot of cancer survivors talk to me about. Is like, I don't know who I am anymore. Who am I? So what is the definition of identity and self? The definition of identity is how you see yourself, perceive yourself, and define yourself. And all of these things are part of mental health. Like I keep saying, mental health is very big. It's not just one specific thing. It's not just depression. It's not just anxiety. It encompasses every aspect of your life, your identity, your personality, your behavior. So why do you lose a part of your identity when you're going through cancer? Cancer is crisis. There's a lot of confusion because a lot of things are changing. If you found your identity, or you've identified yourself in a certain way before cancer and then experience this crisis and going through all these things that's not quite normal, there's a period of time where you're going to question things such as, what am I going to do? How long is this going to last? Who are my real friends? What do these people think of me? And the biggest one of all is like, who am I now that all this has happened? During treatment, again, you're in survival mode. There's no time to think about anything else. Only thing you're thinking about is getting through. So further down the line, there tends to be more space to think about your identity or the loss of identity, depending on how cancer has affected you. Again, a very important thing for us as therapists, oncologists, and a navigation team to remember is every case is different. Every person is different. No case is the same. No cancer care plan is the same. No treatment is the same. So if you're someone who has been very active before being diagnosed with cancer, and you enjoyed hiking and running marathons, and you identified yourself with that, and now all of a sudden you can't do that anymore, you're definitely going to question who you are without that. Who am I supposed to be? What am I supposed to put my time into now? Who am I if I'm not this marathon runner? When you cannot do or even want to do the things you did before that felt like you feel confused about who you are. So what we usually start to do to help people reevaluate that part of themselves is to reevaluate their values. Your values determine who you are. So your values are your central. They are the very core of who you are and your personal identity. Values are very important, and I ask a lot of people, if I have to ask you, who are you, what would you say? And they would say, well, I don't really know who I am. And if you think about it, they would say, I'm a mother, I'm a friend, I'm a good worker, I enjoy sports. But those are all things that you can do. It still doesn't tell me who you are. Who you are is things that are important to you. You're kind of like your non-negotiables. What do you value in your relationships with yourself and others? Integrity, trust, creativity, things like that. Those are your values. It's the things you base your decisions and choices on. It's the things that drive your behavior. Your values determine who you are at the core. And once most people have reestablished their values, which is actually a very difficult exercise to do, they come to the realization, okay, well, if I read through my values and I read that I have integrity, I'm trustworthy, I'm reliable, that's me. This is who I am. And how am I going to use these values going forward to build on my new identity? It's not that you build a new identity just after cancer. You're continuously reevaluating your identity through life. And by reevaluating your identity as you grow or evolve, your values change, your purpose shifts. These things need to be reevaluated ever so often. When you feel or you get to that space, and we all do during life, is life carries on and we get to that place where, okay, but what now? I feel a little lost. I'm not too sure about things. I don't feel like myself. that's the time when you should stop and reevaluate your values, your purpose, your meaning, your identity. You cannot be the same person the rest of your life. As you grow, your values will change because other things become important to you. And it's the same after cancer. You have become a new person. Things don't mean the same as they did before. So what are the important things now compared to what they used to be? And that's going to tell you who you are and where you need to go. Any questions?
Let's have a look and see. Any questions from our listeners at this point in time? Yeah.
Michelle, can I just say something?
Yes, sure, please.
Can you hear me?
You've been so quiet.
I just wanted to say that they're coming out of the AONN navigation on their latest Commission on Cancer, for survivorship. They actually say that, they used to always, have the oncology team put together a survivorship care plan, which then wasn't really ever followed up. So it was almost pointless. So now they're actually suggesting that, you have a full team, backing survivors, almost like during treatment, so that you have, physios and therapists and OTs and everything, to continue through into survivorship and to monitor patients right through, which I think is really good. What you think
very
of that?
important to have. Yeah, and you need to have all those people on board when you discuss the treatment plan, because
exactly,
they're the people that this survivor is going to go back to and see, and they need to know, okay, a year or every 6 months from now, this is what I'm going to do.
Exactly.
I'm going to see you every year or twice every year. You I'm going to see once a year. I have to go for this to increase my physical ability. I have to keep my mental health in check throughout all of these things. And who are my go-to people? Have a list of names, numbers, procedures, things. Because they feel lost and they feel, okay, well, you've taken care of me for a year now. Now I'm done. Now you just let me go. And we've actually had doctors who said to their patients, well, just go live your life. And they're like, but I don't know what to do.
Yeah, no, exactly. No, that's why you definitely, you need a team to follow up. And oncologists are just too busy. They haven't got time to worry about that and follow up with you and sort of baby you because they're so busy, with other patients.
Yeah, but I think that's where you and the oncologist must come
together.
No,
exactly.
But okay, well, we have these people. What would you suggest? What would you want? Can we set up like a form or a template? So we can take it further and have time frames and diarize those time frames so you keep in touch with these people and don't just leave them be. I mean, I still keep in touch, even if it's ever so often, every 3-4 months, maybe even 6 months, depending on how busy life happens. But I still try and keep in touch. It's like a hi, how are you? How has things been going? Because they do get lost or things come up, they get sick and then they start panicking. And who's there to help them through this? And they don't always feel that they can reach out and say, okay, but I know I've seen you for all of this, but now I'm back to almost square one. What do I do?
Exactly. Yeah.
And they need to know that these people are there for that specific thing. So basically you can put it in their hands and say, okay, read this every week or every month and see, where are you? What do you need?
Yeah, exactly.
Thank you. Any other questions?
Okay.
No, I think we can go ahead, Michelle.
Okay, so who am I kind of brings us back to what is my purpose? So what is purpose? Purpose can also be a very broad term, but what in psychology we say purpose is an abiding intention to achieve a long-term goal that is both personally meaningful and makes a positive mark on the world. So that's also quite broad, but you can interpret that in any which way you feel comfortable. Why do you need a purpose? It's important to know because it gives you a sense of purpose, not only to find and do things that add meaning to your life, but it also helps when things go wrong. So if you have a clear direction and a sense of direction, that helps guide you on your path and behaviors. It helps you with your goals, and it helps you apply all those things to your life daily, especially when we have unforeseen events like sickness or accident. And survivorship and finding meaning. So survivors often express the need to understand what having had cancer means to their lives now that everything's over. Many find cancer causes them to look at life in extremely new ways, things they've never even thought of before. They may reflect on spirituality, the purpose of life, what they value, reevaluating their values, as I've mentioned, strength, finding the sense of self, identity. All those things further enhance narrowing down on what they now feel they are and what they actually want to contribute to life going forward. It also establishes a sense of control and that freedom and reliance to deal with life in general. So that kind of comes back to that mental resilience we were talking about earlier. So as we've just discussed, basically, as like the survivorship wellness encompasses a survivorship care program. So that will include lifestyle changes, medication, psychological treatments, alternative therapies, nutrition, all of those things. After all the treatment, a lot of survivors feel completely lost in transition between active care and post-treatment care. They feel almost abandoned and they have so many unanswered questions. They want to know, what do I eat? How do I exercise? What do I do with the rest of my life? How do I care for my emotional well-being? When they finish surgery, chemotherapy, or radiation, there's no longer anyone thinking regularly about their health or their functioning. No one's thinking about their sense of security and well-being. So they're basically on their own. And this is where the survivorship care plan comes in, is to fill those gaps and provide the necessary mental health, the wellness, the nutrition, and all the guidelines needed for survivors to basically start regaining their sense of self and having a way forward. So survivorship plan should have 3 basic parts, and that's to describe the treatment received, the outline plans for future tests, scans, examinations, including surveillance for recurring, spreading, and future cancers, and then to address intervention for a myriad of consequences of cancer. Those can include medical problems such as lymphedema, sexual dysfunction, pain and fatigue, anxiety, depression, how they interact with their caregivers, their family, their work, concerns related to employment, insurance, disability. So there's a lot to think about. And we as therapists recommend that healthcare providers have a formal discussion of these plans with people as they move from patient to survivor. Healthcare providers and therapists should actually work together with the survivor and the navigation team to formulate a care plan for the next 5 years. Survivorship programs are becoming more common, yet in my opinion, I think they're still lacking quite a bit. Okay, health and nutrition, just a short summary there. I think most of us are familiar with that. Exercise, again, these are all bullet points that we should add to the survivor care program. What exercises can I do based on the cancer, or the surgery, or the treatments I've had? How do I control my weight, whether it's to gain weight, whether it's to lose weight? How do I use food as medicine so there is less recurrence for any type of cancer? We all know how big a role nutrition plays in any illness and disease. Also, list alternative therapies that these people can use. What do I do now if I feel these aches and pains coming on? Who can I see? I don't necessarily have to go to the oncology team for everything that happens, but because they're so scared of recurrence, now we have to have a backup of alternative care healthcare providers for our cancer survivors. There is acupuncture, there's Reiki, there's hyperbaric oxygen therapy. There's loads of things that people can use that we need to present them. So as you can see, it's huge. Mental health encompasses everything, and it basically sums up or is the basis that form a survivorship care program for anyone who's dealing with cancer, going through cancer, and after cancer. And that kind of brings us to the end of, if you need help, talk to your doctor, reach out to other people or cancer groups. Philotomo is amazing in this regard. This is where lots of our people go to when they need help, when they need guidance, when they want to know where to go. So Philotomo is basically your one-stop shop for everything. And then seek more mental health information. I mean, mental health is not a disease, it's not an illness, it's a way of coping with day-to-day stresses. And then, yes, reach out and talk to us. Philotomo is there. We're here to educate. We're here to provide information. We're here to help give you assistance and tell you where to go. So in short, we're a very informal cancer care survivorship program. So any other questions? Thank you, guys.
Thank you, Michelle. Very, very informative, very interesting. I think we could have gone on for days and days. So many different aspects to the cancer journey. Could we invite anybody to ask any questions at this stage? Anybody want to?
I just want to ask Michelle one more thing, Steve. Michelle, do you do? They say with like to have a mental health assessment at each stage of the cancer journey. So at diagnosis, obviously to see the reaction, and then obviously going through treatment, and then obviously into survivorship like we've been talking about. I mean, do you agree that it should be as thorough as that? Because I mean that's what they do, they say that should be done.
That is actually how it should be done. I mean, you're going into this and you have your mental state is one way, then you're going through it, so you're kind of getting used to it, you're adapting, adjusting, but the survival mode, the trauma of survival takes over. So you're literally 24/7 in fight, flight, or freeze. And that creates huge stresses, not only in the brain, but also in the body. And that can either set back treatment or it can further treatment. So you constantly have to reassess the mental health or well-being of a patient from start to finish and beyond. It's really very important because it changes all the time. We all know that you can have setbacks with cancer. You can go for chemo. Things can happen and you have to go for surgery, or you can have a huge setback. That mental health is going to shift instantly. You have to be there with backup strategies to help this person through that trauma.
Thanks for the question, Nicole. Michelle, what if you have? What happens if you have a cancer patient that's just resistant opening up to discuss anything related to the disease whatsoever? Let's take an elderly, for example. Doesn't express any kind of thoughts about the diagnosis, doesn't appear to want to engage with anybody based on this. And I know everybody's different, and every aspect of the mental health assessment must be treated subject by subject. But in a scenario like this, how do we as a support structure because you don't want to enforce what you believe the correct prognosis to be, but at the same time, we also need to respect those boundaries.
Okay, the best way for this is, that's actually a very interesting question. We had a discussion about that yesterday about, how are you feeling? I don't know. What do you need? I don't know. That all comes from resistance. And resistance, normally therapists would approach resistance as, okay, but you're not giving me the answer I need. And that's actually the wrong way to go about it. When you have that type of resistance, it's merely a form for that person to avoid having to deal with what they don't know what to deal with or how to deal with. And when you have a person that doesn't know how to approach it, so they try and avoid it, and we all do that. We have avoidance strategies because we don't want to feel a certain way, or we don't want to go a certain place, so we avoid it. It's empathy. So instead of asking them a question and expecting an answer, say, okay, I understand that this is a really crappy situation you're in right now. I don't know what I would do if I was in this situation, and step back and let that person think about it. Once they've had a little bit of time to think and see that you're not only there to see how you can help them, but you actually have some form of understanding of what they might be going through, they're more likely to open up.
Often they also say, they call it ambivalence, where you just aren't sure. And I think a lot of the time at that initial diagnosis, the absolute, like we know, the shock and, to accept everything. But then often, you just need to also give them a little bit of time, I think. And then, often they do open up. And as Michelle said, there's I did a course called Emotional Interviewing with patients, and like Michelle says, you try and use specific questions and try and build their confidence, in sort of other ways to try and get them to open up. If, like you say, what are you afraid of? What worries you about the chemo? To just try and get them to, and then of course you come in with the knowledge, with their permission. They call it elicit, provide elicit. So you will, try and open as a question, see how they respond, and then almost ask their permission to if so that you can give them more information if you see that they want that. That's one of the.
Definitely.
Yeah.
And just to add on that is like a form of resistance also sometimes the therapist has to take a step back, or the navigator needs to take a step back and come with that empathy, but also realize that whenever you as a navigator or a therapist ask a question and you're experiencing resistance, you haven't asked the right question, or you have to ask the question a different way.
Yeah. It's very.
Does that answer?
It does, and I think it must be quite overwhelming for someone who's just recently been diagnosed. Let's assume that the person that we're identifying for the purpose of this discussion is a person that's just been diagnosed.
Yeah.
How do we approach the first consultation? Because we've heard the suggestion that one needs to have this multidisciplinary group of people, and everybody is a specialist in their particular field. So in an ideal world, if we would have taken a organogram, and I see Raquel's nodding her head there. Happy birthday, by the way, Raquel. It must be quite a difficult thing to see this huge organogram of suggested professionals that are now going to be responsible for taking you through this journey, Michelle. How do you deal with that? Is it done piecemeal, or do you say, look, if you want the best, there's a BMW, otherwise you must drive a this? That was for your purpose.
It kind of all depends. It also depends on the person. Some people are very good in stressful situations, so they can take whatever comes their way. Other people completely, they tap out. It's like they're not even there. So again, you have to play it by ear and see what type of person you're dealing with. And I think in Nicole's and my situation, for us, it's easier to read people because that's what we do on a daily basis. You meet someone for the first time, you can kind of gauge which way they're going to go. So that kind of helps. But again, I think with early diagnosis and having that overwhelm of information thrown at you, where half the time you don't even understand the linguistics, it's like, please, can you just talk English? It's always good to take someone with you on your feedback appointment in case that's your first diagnosis appointment, so they can also help take in everything that you're probably not even going to remember afterwards. And I would say, before you give them the organogram, is just let the information sink in. And again, come with the empathy, come with that level of, okay, I have no idea what you're going through now, but I can understand that if that was me, I would probably be where you are, or even worse. Just extend them like an olive branch as such.
Yeah. Because John, what we often also is that you actually, if you can see the patient's taking strain, or that initial, you can actually say, how much would you like to know, or how much do you know, and how much would you like to know about your diagnosis now? Because that also gives you, a little bit of, as a navigator, where they're at and how much they do understand. And I mean, I find that, well, at Helen Joseph, because Carol, she doesn't spend as much time with the state patients because she's under such time pressure. Often the patients will say to the navigators, they didn't understand it all what Carol said. She spoke too quickly. So, we've got to then go back in the file or ask Carol, sort of what she said. But I think it's very important that you ask when you're speaking to the patient, is how much do they understand to them and to the families, obviously, with them, which I think is so important. And then, just to, so that you can, and I think you can get a feel from that. If, most people haven't got a clue, but some people may have more of a clue. But I think that sets the tone for how much, and how much would you like to know, I think helps too.
Put them back in the driver's seat, because it is their diagnosis.
Yeah.
It's a very nice question, because what we do is when we experience that resistance is, okay, but if you don't know, what is it that you don't want to know? Or what is it that you do want to know? How do you feel about not knowing?
Yeah.
If you're very unsure about a person's reaction or how much they actually can cope with, you always revert back to what they're feeling, because the feeling will indicate how far you can take it.
Yeah, that's very true.
Thanks, guys. Thank you.
If I could just add,
Go ahead, Raquel.
can you guys hear me?
Yeah, we can hear you.
Yeah.
Okay. With regards to that initial diagnosis, Prof. Ben is my doctor, and she was actually the one who gave me my diagnosis. You have cancer words. And unfortunately, because of COVID, I was on my own, and I was not expecting her to say that. And I mean, she was in the room with me for a long time and explained everything. But I think after you have cancer, like my brain even shut down from all that time. And I didn't even realize how long I was in the room with her until afterwards, when I looked down at my phone and realized what the time was. And what I think Carol does that is absolutely brilliant is you leave there with articles and information, reading material, physical reading material in your hand that explains your particular diagnosis, which was absolutely key for me to process what had just happened. And I think for me, I process information. I need the information. Give me as much information as you can. So that night I sat and read through everything. For a person who is not ready for that, they have the choice not to read that just yet and put it aside. And that really was so key for me at the start of the whole journey, and mentally to kind of get my head wrapped around what I had just been told. Because you sit in that room and even being explained and told, like, a lot of it doesn't actually sink in. So to be able to go home with something that you can refer back to was really helpful. And the other thing that I did, also because of COVID, I've attended most of my appointments on my own. I've actually started recording them so that when I get back home, I can sit with hubby and re-listen to it and kind of process again, and we formulate questions together, and then go back to the navigators or send the doctors emails again and ask questions. And that has been, probably that has helped me a lot in processing information overload.
No, that's amazing. I was going to mention that, yeah, we do suggest recording your appointments, because it's a lot to take in. And like you said, half of it didn't even really sink in. But, leaving prepared as such with more information, whether you read it or not, like you say, that is definitely key in calming the person down and giving them back a sense of control.
Yeah, I think that's 100% correct, Michelle. And we always say the more information you have, the better decisions and choices you can make. So, and as Raquel so rightfully said, you can get that information at the initial consult, and then how you choose to read through it at your pace is a decision that you make when you feel ready. It's not, you go home with 150 book, pamphlet thing, and you have to read it all in a day and have it done by tomorrow and write the test. It's like, here it is. If you want to read it all, that's great. And Raquel's said she's the type of person that needs all the information so that she can start understanding the process. And there will be others that are going to obviously do chapter by chapter, and that's fine. And I think that's the main thing that we want to get across, especially with the help of Nicole, who is our navigator, in these circumstances where people are going for that initial appointment or the second follow-up, perhaps, that haven't had an opportunity to understand what's actually happened. Because as Raquel says, when you hear those words, you kind of just shut off. Your mind just automatically, no matter how strong you are, I think you've always got that fear that kind of takes over, and your mind just completely shuts down. And that's why the importance of having someone with you or a navigator. And John was making a note, and he made a note here to ask about COVID, because I think COVID has had a huge role in terms of how cancer patients are having to actually deal with these diagnoses on their own. Because as Raquel said, you know, she was limited. She couldn't take someone as a support factor. And I can only just imagine how much more strength that takes from a cancer patient to have to go through this like almost completely on your own.
Yeah.
And maybe
but also, yeah, Evie, I also think that, yeah, I mean, it's also good for a navigator. I mean, if you can't be in on that initial diagnosis, is then maybe give the patient a little bit of time, and then as a navigator, if you have all the information on the diagnosis, whether you've been in or not, or if you have access to the files, is to then, you know, like a few days later, often then things have sunk in a bit more, and to go over everything again, you know, and just see how much the patient understands. Because I mean, of course, as Raquel, I mean, when you're highly educated and you're going to Prof. Ben at Mill Park and you've got medical aids, and you know, you've also got to assess the patient's level of education, you know, how much they understand language, you know, culture. There's all of those things too that, you know, you have to look at. It's all very well. I was exactly the same. I mean, Carol gave me all those handouts, and I got home and boy, I was reading them immediately, and I love them. I mean, I still go back and read a lot of that, and even my own pathology reports, you go back and see, but not, you know, the state patients don't have any of that available, and they don't. That's why at Helen Joseph, I actually have got all of my own pamphlets that I've got from American Cancer Association that I print, and they've got really nice little printouts with very basic stuff. And they really, you know, when you give it to the patient and they can actually read and see, you can just see it makes such a difference, and they're actually really grateful, you know, to have that, you know.
Yeah,
Definitely.
100%. And I think we're running out of time, but that's okay. It was such an interesting topic, Michelle. As you said, I mean, we could go on for hours and hours talking about.
Literally, I mean, mental health is like never ending.
It is never ending, and I think, you know, what we've taken, I think, from this session and the information is that first and foremost, most important is your mind, and the more we can work on getting the mind correct in whatever situation you're finding yourself in. As a cancer patient, as the conversion between the patient to survivor, as you mentioned, because your title does change through your journey, because you've been the patient, as you said, you're now becoming the survivor. It's a different mindset. But I think also the mental mindset of those that are around the cancer patient and or survivor and or, you know, the family members and friends, because it does affect those around you, and how you feel mentally with always being the strong person to try and motivate the person that you're looking after or caring, or your partner, whatever the case is. So yeah, first and foremost, strong mind, strong body, strong outcome. But we all know the journey is not always easy, and that's why we are very grateful for you, Michelle, as a cancer coach and one of our preferred partners to be able to help anybody through this process. And Michelle, I'm sure that anybody on this process can come to you at any point in time. Is that correct? They don't have to wait till the end of the journey only to go and get, because I think
no, not at all.
Sometimes
not at all. They can reach out anytime. Anytime you feel you're not coping, or you're not sure, or it's too overwhelming, or you're frustrated or angry and you don't know how to deal with stuff, that's usually when you should reach out.
Okay, that's great to know. Any other last questions before we close off? No? Michelle, we also want to use this opportunity, if you don't mind, to wish Nicole all the best. For those of you that haven't heard yet, and Nicole's going to take on a challenge on the 6th, correct me if I'm wrong, Nicole, 6th to the 9th of August. Nicole has a very special day coming up on the 9th of August, and she'll tell us a little bit about that in 2 seconds. But we want to wish her the best of luck. She is taking the challenge to summit Mount, where is my notes? Mafadi from the 6th to the 9th. So from our side, we're wishing you all the luck. We're going to be watching your Instagram and Facebook for information on how your challenge is going. But maybe if you want to just give us 2 seconds of your challenge, why you're doing this actually as the most and foremost, most important reason actually.
Okay, yeah. So I actually had my my bilateral mastectomy on the 8th of August in 2017. So it's quite relevant, and I was invited by the Women of Stature, which is one of the foundations that I got involved with. I met Charlotte through at a breast health foundation function just after my surgery. So there's quite a lot of impotence with Women of Stature and Breast Health Foundation, and I actually did my speakers training through them. And then so when Charlotte invited me, I thought, well, you know, that's a really nice, as Michelle says, sense of purpose. It was it's been a great new goal for me, you know, with my, you know, having been a runner to then take up hiking, but I've absolutely loved it. We have amazing leaders. Both of them are like pioneers in South African mountaineering. Saray Khumalo was the first Black woman to summit Everest, and Sibusiso was the first Black male to summit Everest. So, and they've done South Pole, North Pole. Sibusiso's done all the 7 summits of the world, the highest summits. So it's really a nice group, and you know, for me, it's just a nice challenge, and I'm really enjoying it, and I'll probably want to continue, but I think I'll first see how this goes. But I'm looking really forward to it, and yeah, the significance, you know, it was just quite yeah, weird how that like worked out at the time, you know. So I mean, I've got Carol telling me I better put it on Instagram and have my pink beanie on, and when I summit. The only thing is we don't get very good reception there, so I don't know how many pictures will come through until we get down, but I'll see what I can do.
Yeah. The words from an awesome marathon runner to now soon to be an amazing hiker. We wish you all the best, Nicole, and we'll be watching. And yeah, I think we've come to the end. So once again, a huge thank you to everybody that joined us today. I hope that the information that Michelle shared is something that you'll take home with you. And if you have any questions, please feel free to message the project or email evy@philotimo.org.za. I am going to, Michelle, if you're happy with that, just share once again all your details on our link that we're going to be sending the recording of today's session to. And please feel free also to contact Michelle directly should you need anything else. From our side, huge thank you. Please stay safe, everybody. John, closing off.
Yeah, big thank you to BMW Bryanston for supporting this particular webinar, our partners in that side of the business. And yes, of course, for more information regarding our project and what it is that we do, please check out our website, philotimo.org.za. Remember, we're here to help create awareness and educate for those people who are affected by cancer. So love to you all. Thank you for seeing us. Next week, we've got a break, but I think we'll be back again at the end of the month. Thank you, guys.
Everybody.
Be safe. Take care.
Thank you, everyone.
Bye.
Thank you.
Bye.